Hey YouTube, it's Dr. Nikki Hill, board certified dermatologist, hair loss expert. So today, let's talk about alopecia. What is alopecia? So alopecia is the medical term for hair loss. Anytime the hair is shedding, breaking, not doing what it's supposed to do, that term is called alopecia. It is considered an umbrella term in my book, meaning that if someone has alopecia, that's very generic. You need something more specific. There's over 20 different types of hair loss disorders or types of alopecia. So you really want to make sure that the individual or yourself, if that's the case, has a very specific diagnosis to which type of alopecia you have. Under alopecia, I always break it down into two main branches. So you have your non-scarring side of alopecia, which means there are either internal or external stressors and distractors. So it can be surgeries, it can be medications, it can be starting and stopping herbal treatments, moving, pregnancies, birth, things like that. Sometimes it can be something that you wouldn't even think would be a major concern that actually allows the hair to shed out. But the main thing about non-scarring alopecias is that the follicle's intact and it's healthy. It's just that there's so much distraction, the metabolism isn't going to be able to grow the hair like it needs to. So the scalp sheds the hair, but the follicles are nice, they're safe. So in that instance, once the distractor is removed, once you heal from the surgery, once the stress is removed, the nutrition is corrected, or if there's any medication changes and the body gets adjusted, then the body will be able to regrow those hairs because the follicles are healthy. On the opposite side of that, you have the scarring side of alopecias. So the scarring branches, those alopecias, they do something a little different. So I'm going to bring you over to my board because this is the board I actually teach all my patients with. I love it. And it really helps with the visual. All right, so this is a diagram of the scalp. In theory, your follicles are actually anchored down into the fatty tissue. Your scalp is super, super thick. So that's another myth that we can talk about later, that the scalp is just paper thin. That's not true. I biopsy scalps all the time, and they are rather thick, almost as thick as the depth of a pencil eraser, if you can imagine. So in theory, or in reality, this follicle is anchored down to the fatty tissue of the scalp. Now, when there's inflammation, I always say the body is making white blood cells as part of your immune system. So they're always kind of trucking along in your blood vessels, and their purpose is to come out of the blood vessels, go into the skin, see if there's any threats. If there aren't, they go back into the blood vessels, and then they are carried away. In the instance that there's a threat, whether it's a bacteria, it's a splinter, it's something foreign that's not supposed to be there, then your immune cells will come out and they'll kind of circle around this foreign threat. What happens is later there's going to be a cascade of events that allows the body to come and wall off that threat, laying down collagen, which is a fancy term of saying scar tissue. Now, when it's walling off this threat, it's actually preventing it from getting oxygenated blood, nutrition, and even more so, actually being able to get down into the blood vessels and cause someone to become septic. Well, we do need this acute inflammation to really help with our health. However, sometimes with inflammatory scalp conditions or scarring alopecias, these white blood cells come out. There's no threat, but they just stay out. Now, when they're staying out in the scalp, this process of making collagen continues, and now it becomes a chronic issue. Chronically, the scar tissue isn't going to break down. And I always say scar tissue does not respect anatomy. So it starts to replace and remove follicles, replace and remove sweat glands, oil glands, and it starts to change the anatomy of the scalp, which essentially changes the function of the scalp. So now if we knocked out this follicle, we're going to start losing follicles or hairs one by one by one over time. The other problem that happens is once we lose this follicle, we're not going to be able to regenerate it because scar tissue cannot regenerate follicles. And we haven't gotten to the point yet in research where we are able to regenerate follicles and place them into the body. And so it's really important to make sure we capture this inflammation early so we can stop this chronic ongoing process of collagen being placed in the scalp and essentially also removing follicles. So that's alopecia, scarring type, and we just talked a little bit about the non-scarring type of alopecia. So stay tuned and we'll start talking about other things, hair, nails, and skin related. I'm Dr. Nikki Hill, board certified dermatologist, hair loss expert based in Atlanta, Georgia. Thank you.